Hi there, welcome to what we hope to be future filming. This is our first, and I wanted to introduce you all today to Dr. Anisha who has joined our team. And I think one of the strengths of integrative medicine is that we have a real appreciation for the fact that there are many, many ways to heal. And also an appreciation for what other cultures have learned through the eons that they have been using different strategies of healing. Dr. Dervais has an expertise in Chinese medicine and Ayurvedic medicine, and she's going to talk with us today about traditional Chinese medicine. So welcome all. And if we could start with what I think is really interesting about Chinese medicine, which is the philosophy by which you approach patient care.
The philosophy is really rich, and it was really what drew me to this medicine, is understanding that we don't look at the body and the mind as two separate units. We really look at not only how they are connected and speaking to each other, but how they're fully integrated. And so we really use the word body-mind as one complete entity. And so the idea is any physical symptom is always going to have an emotional component. Any emotional symptom is going to translate into affecting physical symptoms down the road as well. And I think as patients, most of us have experienced that, right? Most of us have experienced when we're stressed, how do we feel that in our body, right? Or if we're in pain, how does that emotionally make us feel, if we're continuing to live with that chronic pain. So it's a concept that is not just unique to TCM philosophy, but it's something all of us can relate to and understand, that taking care of ourselves and our well-being has to address body and mind. We really can't look at one without the other. And so as a TCM practitioner or an acupuncturist, this is one of the things we're looking at is the entire landscape of the body is like a garden. So if you're taking care of a garden and you're tending to it, we might have weeds that we want to pull out. There might be an area that we've neglected to water and we need to nourish the soil there so the plants will grow, right? We want things in our garden to be blooming and growing and fertile. And so we're kind of looking at the body as like an irrigation system and as a garden. And where do we need to nourish it? Where do we need to tend to? Our pain, for example, or our anger is like those weeds that we want to eliminate because they're blocking the flow within the entire garden. So that's just kind of a simple metaphor, but that's the way we're thinking, is how do we look at not just one part of the body in isolation or one symptom in isolation, but how does it affect the whole landscape?
Right. So an appreciation of how everything affects everything. Yeah, I really like that. So given that, because that could cover a broad area, if you're looking at mind, body, emotions, etc., how do you go about making a diagnosis and therefore formulating a treatment? Because it's a whole system, right? So it has to make a diagnosis and treatment. Tell us about that.
So our approach with that is really in the initial visit, when I see a new patient, we really want to take time to go through a very detailed, complete history. So we're looking at the entire arc of someone's life from birth until their current timing that they're seeing me now. And we're looking at all of the individual signs and symptoms they might be having, but I'm trying to see how do they all fit together and how does one thing maybe affect another, or how does one symptom long-term turn into another symptom. And so sometimes a client might have some idea of symptoms being connected, but a lot of times they see them as random symptoms and they don't associate them together. So that's really my job, kind of being a detective of putting those different symptoms together. And we're not making Western diagnoses, but we're looking at, from the TCM framework, we're looking at qi or energy, we're looking at blood, we're looking at yin and yang, and I know those are terms that don't necessarily make sense to the public, but essentially we're looking at energy flow, and where is that energy flow getting blocked physically, where it might create pain, or is energy flow getting blocked mentally, where it's creating stress and anxiety and frustration and depression and the whole spectrum of emotions. So that's what I'm trying to tie together in that first visit as we go through this detailed history, is how do all these different symptoms come together and translate into a TCM diagnosis. So someone might be coming in with anxiety, but when I interpret it through the TCM lens, I might call it heart chi deficiency, or I might call it liver chi stagnation, or spleen blood deficiency. And so those terms don't make sense necessarily to my client, but that's how I'm trained to pick the right points and to develop my treatment plan, is by understanding the underlying energetic imbalances and which organs are affected.
So that's really your root cause.
That is the root cause.
Right. Okay, and so you're listening to an extensive history, and with that you're listening for a pattern that's represented there. And then you also have some unique, more hands-on diagnostic techniques. Can you tell us a little bit about that?
Yes, the two main techniques we use are pulse diagnosis and tongue diagnosis. The tongue is a little bit simpler, and I know people feel funny sticking out their tongue when they come to see me, but essentially all of the body's organs are mapped out onto the tongue. So very simple thing, and anyone can practice looking in the mirror, take a look at their own tongue and just kind of see what they observe. But if someone has insomnia, one of the classic traits is the very tip of the tongue, which connects to the heart energy, will be bright red. So the brighter the redness is, or the deeper it is, the more severe their insomnia is. So that's just a very simple, quick, easy thing that anybody could look in the mirror and start to observe that. So we use the tongue diagnosis to really confirm what we feel in the pulse diagnosis. And with the pulse, we're feeling 3 different positions on each wrist, and we're feeling a superficial and a deep layer. So in total, we have 12 different pulses that connect to the 12 organs. And so as I feel each of those pulses, I can see the energy of the liver, for example, is really excessive, or I could feel another organ feels weaker. And so it gives us a sense of the strength energetically of each of these organs. And that also helps me determine which points I might choose, or which meridians I want to work on, based on the feedback the pulse is giving me, which keeps changing from visit to visit. But that's how I see people are also improving or noticing resolution in their symptoms.
So from a Chinese medicine perspective, the pulse carries a lot more information than what we're used to finding from a conventional medicine standpoint. The tongue, which I think there's more and more of an appreciation that it reflects what's going on in the GI tract from a Western standpoint, but from your standpoint, it tells a lot about all the organ systems. And I suspect some of our patients have gone into the bathroom to quickly check the tip of their tongue. So one of the other, so that's really helpful to appreciate how sensitive your exam is, and how it looks at things differently.
But we're also looking at any feedback we can get from the person, right? So like the sound of their voice, if they're making eye contact or not, their posture, right? So someone with depression is probably not sitting up nice and tall, but they might come in, with kind of a sunken chest and looking down and not making eye contact. So I think all of us can relate to body language, and when we're talking to someone, what is our initial gut reaction with that body language? We're trained to look at that body language and also turn it into the language of TCM. Does it connect with a heart energy or liver energy or spleen energy, for example? And that also adds to our detective skills and coming up with that TCM diagnosis.
Right, and so one of the interesting things also is when you talk about liver issues, you don't necessarily mean what I mean when I say your liver function tests are not quite right. Can you tell us a little bit about that?
And I always do clarify that with patients, because that can be very confusing. So when I say that your liver is excessive, it doesn't necessarily have to deal with liver enzymes or anything you would read on any type of blood work or lab report. but we're speaking purely energetically of each of these organs. So we have 12 main organs, 12 main meridians in the body. So each meridian or channel is connected to one of those organs, and is connected to one of the pulse positions as well. So we're really talking about energetically, each organ has, we would say, liver chi or spleen chi is like the energetic state of that organ. And we have kind of our own associations of each organ being connected to an emotion, being connected to certain signs and symptoms. And so that's the language we're using to come up with that diagnosis.
And that's a real distinction from more conventional medicine.
It is.
Okay.
Mm-hmm.
The other thing that I appreciate a lot about Chinese medicine is that it has a real emphasis on prevention and the ability for people to cultivate wellness even as they age.
Mm-hmm.
Can you talk to us a little bit about that approach?
Absolutely, because I think that's one thing about acupuncture specifically has become more popular and well known for pain management and disease management and helping with all sorts of symptoms across the board, but it's still not really talked about as much for prevention and for maintenance. So this is something I try to make clear for all of my clients is when they come in for their initial care, and most people will average anywhere between 1 to 3 months of usually coming in every week, building up that cumulative effect of acupuncture. And so usually from visit to visit, there's some steady improvement in symptoms that patients are noticing. After that initial period of care, my goal is to get everybody on maintenance care, and that's really thinking long-term for prevention. So if you have a number of symptoms, they've all cleared up, you've responded well, within a matter of time, those same symptoms might resurface again, right? So we have to really look at, have we really just eliminated those symptoms for now, or have we prevented that same root cause from getting triggered all over again? Mm-hmm. And so the maintenance treatments I recommend is usually once a month. Mm-hmm. For women in particular, I'll recommend once a month, being the timing, the week right before their cycle starts. So that's the most ideal time to balance the hormones. And so for most women, we can balance the hormones, be PMS free, pain free, so that the cycle doesn't have to be this emotionally turbulent, distressing week. So for women, I recommend really being vigilant about that week before the cycle. For men, it doesn't matter as much, but the same monthly maintenance protocol. In ancient China, what was recommended was to look at prevention seasonally. And so we recommend, or the ancient Chinese would recommend, that we came for acupuncture 4 times a year at the juncture of the seasons. So if you notice, the time when everyone's catching a cold and there's some virus going around, it's usually at that juncture right before the seasons, mm-hmm. right? So the ancient Chinese said, if we can boost up our immune system then, and if we can work preventively at that transition time, it sets us up for the rest of the season to be healthy. Right. So it's really beautiful ancient wisdom, and yes. Most of us just, are not paying attention to the seasons, or, mm-hmm. we kind of get busy with our lives and don't really think about honoring each season and what should I do to prepare for that.
Right, and if you think about it though, doing these preventative things, which we do, we brush our teeth to prevent cavities and decay, mm-hmm. we exercise and eat well to prevent heart disease further down the road, etc. So mm-hmm. this is another strategy that Absolutely. Is time proven over millennia
Absolutely.
To be really effective, and I think a real strength of these ancient techniques. So I recommend you all avail yourself of what we have here now in this gift, Dr. Dervais joining us. And if any of this sounds really resonant or interesting to you, please do reach out to our team. 305-243-5267 is how you can reach us directly. And we'll look forward to welcoming you back here into our new clinic. Take care.